So the Geiger test is where we just left off with the first video. Picking up here, there's a quick video that comes with our textbook. If we have time towards the end, it's a nice review. It'll review pretty much all that we talked about for ankle sprains at this point. Other common injuries of the foot and ankle are arch sprains. Arch sprains are generally rather painful. They're caused by overuse, overweight. Athletes have a tendency to flatten out that arch and put a lot of stress on that bottom portion of the foot. People have fallen arches. You may have heard of that. When they're non-weight bearing, they have the normal arch. But the minute they stand on a flat surface with their body weight, those reaction forces actually splay the bones of their foot based on weight distribution on that hard surface. Non-supportive shoes are also somewhat of a concern. When you're buying footwear, arch support is a very important feature of most footwear. When the arch falls, instead of the Achilles lining up in that mid-sagittal plane, there's a valgus force causing that deltoid ligament to have a little bit more stress applied to it. Arch sprains can be treated with cold compression elevation. Turf toe, another injury that's common in the foot, ankle, lower leg. Obviously, this is in the great toe. Is it a strain or a sprain? Most of the time, the ligaments that hold the toe bones together are what is stressed. So you can see here that in this toe flexed position at toe off, just trying to get an explosive push off puts enough stress in between these two bones of the toe to tear the ligaments. So in that case, it would most likely be a sprain. Treatment, obviously for sprains, toe hyperextension, price, protection, rest, ice, compression, elevation. When they're back to return from a turf toe injury, there's actually a turf toe tape job that we've kind of read about, and some of you have actually practiced. Blisters happen by friction. So as friction increases heat, the body starts to try to dissipate that heat by a pocket of white blood cells decreasing that friction. You never want to disturb a blister if it's has not already popped. So you try and maintain those while the healing process is going on. The body will start to slough off the dead skin eventually with a friction blister. Plantar fasciitis. Again, this is the base of the foot. The tissue becomes strained from overuse. Footwear, tight Achilles tendon, running on hard surfaces are the primary cause. So in your history, you could evaluate their footwear. They'll often say that the morning, their first step on their foot is the worst. And that's because at night they sleep and their arch is kind of really relaxed. There is no stress on the plantar fascia, which is at the base of the foot. And so a treatment is called night splints, where they prop the ankle into a dorsiflexed position. So this is a solid brace, and it's velcroed at the distal end of the calf and the distal end of the foot, keeping this 90-degree angle while they sleep. Icing and massage are also indicated treatments for plantar fasciitis. Heel bruises, so a lot of pressure, a lot of stress occurs at the heel. There is a fat pad that occurs naturally below the calcaneus, but when that fat pad is pinched between the calcaneus and a hard surface, bruising can occur. Ligaments, tendons, and fat pads are subject to stress injury, treatment, price, and then these heel cups are very supportive, and they take a lot of that compression force away. Heel spur, a bony outgrowth, exostosis of the calcaneus. It's painful, generally there's inflammation surrounding that tissue, causing inflammation into the soft tissue. Some treatments include, you could tape around it or put a shoe insert actually right around, a donut right around that bony outgrowth to disperse those stresses when the shoe is on. Fractures can also occur at the lower leg and foot, because it's a weight-bearing part of the anatomy. It's immediately inability to perform even normal gait patterns. The site of point tenderness is generally where the fracture would be. This is a referral and determination on imaging. Contusions in the lower leg, they occur most often in the shin region, so between the knee and the ankle. It's usually a result of a direct blow. And again, I mentioned earlier that contusions in this region of the body are dangerous. It's actually a medical emergency. So the lower leg compartments are shown here. There's a lateral compartment, a superficial posterior, a deep posterior, and an anterior compartment. And the blood supply and nerve supply to the foot go through this region. And so as the compartment starts to fill up either with swelling or blood, it can impinge and choke and occlude the blood flow, causing tissue death down in the foot. People who have a compartment syndrome are at risk at losing their foot due to the fact that the blood flow can no longer oxygenate the tissues, and the tissue will start to become necrotic. It develops when there's swelling within one or more of the leg compartments. Treatment, immediate transportation to the nearest medical facility, especially if it's that anterior compartment, because anterior compartment syndrome is the one that puts the most pressure on the blood supply and nerve supply to the distal end of the extremity. Strains occur along the muscles, normally result either from a violent contraction or an overstretching of the muscle. Can occur in the muscle belly or any portion of the soft tissue of the muscle, the musculocutaneous junction. So a couple of key muscles in strains: tibialis anterior, the peroneals sometimes have a predisposition, popliteus, and the gastrocnemius. Any of the leg muscles, though, can be strained. Muscle cramps. Really, muscle cramps, if athletes are cramping up, you really should check their water levels, their hydration. Muscle cramping is usually from dehydration of the body, and that dehydration is starting to act on the muscle's ability to contract and relax. They're brought on by a sudden involuntary contraction, and the muscle just goes into tetany, which is a continuous contraction. Sometimes they pulsate, so it'll contract, relax, contract, relax. Treatment is rehydration and passively stretching and actively contracting the other muscles, the muscles on the other side of the muscle that is going into cramp. So if it's a hamstring cramp, you would contract the quadriceps, and likewise, vice versa. Also, rest, ice, and massage are indicated as treatments for muscle cramps. Achilles tendinopathy, so an inflammation, but again, some of those inflammatory components, the white blood cells, they're not necessarily present, but it is a weakening of the Achilles tendon. Tearing of the tendon caused by excessive stress could cause that Achilles tendon rupture. And there's a special test called the Thomas test, which is part of the regimen of squeeze tests that I'm going to show you a quick video on here shortly. So Achilles tendon ruptures are another one of those, has to happen soon, surgeries, because the longer you wait, atrophy starts to set in and the tendon starts to migrate away from the injury site. And so eventually that window of opportunity to surgically repair the Achilles tendon closes. So here's the quick video of the Thomas test and a couple of other quote-unquote squeeze tests.
How about the squeeze test? There are several of them. One at the mid-calf that will test the high ankle sprain. Another one at the calcaneus. You squeeze the calcaneus. It will test the stress fracture of the calcaneus. The other one at the metatarsals. You squeeze the metatarsal heads, and that will test the Morton's neuroma.
So that squeeze test for Morton's neuroma, it's compressing the bones of the foot to actually put some pressure on the nerves, the distal ends of the nerves, sensory nerves in the foot, and a positive finding is increased pain for Morton's neuroma. So really, shin splints that's like the common catch-all phrase for any pain that a person is experiencing between the knee and the ankle. Shin splints, in the true sense of the orthopedic sense, medial tibial stress syndrome, it's normally involves posterior tibialis muscle and its attachments to the tibia. Again, it attaches to the periosteum surrounding the tibia. Long-term treatment, biomechanical assessment of the lower extremity may be indicated for some athletes, anti-inflammatories and flexibility program. Really the best acute symptom treatment is an ice cup. So a frozen cup of ice with the tip of the ice exposed and just massaging along the medial surface of the tibia. So here's where most of the pain will be, the athlete will complain most of the pain is coming from this medial aspect. So again, I told you how important it is to be able to identify structures. And so the structure in front of us, that's pretty common. This is a right leg, this is a left leg, but is this a right leg or is this a left leg? How do you tell? Is that an anterior view? Is it a posterior view? At first glance, it looks like that's an anterior view because you can see the foot, but this is the calcaneus, all right? And these are the condyles of the knee. So this is actually a posterior view. So looking at this posteriorly, with the fibula being to the right, this is a right lower extremity because we're looking at the back side of it. Now this is tibialis posterior, and its attachments are all along this medial border of the tibia. And as this muscle initiates plantar flexion, this is the primary plantar flexion muscle in the body. So all of the weight to propel the athlete forward. All of the body weight is being assumed here by this